gentlemen, I am pleased to welcome all the participants to the webinar Beyond Cancer Treatment, Enhancing Well-Being with Right Knowledge, Positive Thinking and Diet, a novel initiative by Forbes Care, Max Clinic and Samrohana Cancer Foundation. I am Aditi Mukherjee, Northern Lead, Patient Care and Engagement Vertical, Forbes Care, and I'll be your host for today. We have with us Dr. Sandeep Nayak, Chief of Surgical Pathology, Max Clinic, Ms. Jayatri Mandal, Senior Oncologist from Forbes Care, and Ms. Sharmila Devi, Senior Oncodietitian from Forbes Care. We believe that this online webinar will make a real difference in the lives of cancer patients and their caregivers. Now, we will welcome Dr. Sandeep Nayak. It's an honor for me to introduce you, sir. Dr. Sandeep Nayak is the Chief of Surgical Oncology, Max Clinic. He is currently appointed as the Director and Head of Department of Surgical Oncology at Fortis Hospital, Bangalore. Apart from writing numerous scientific research articles, he is relentlessly working hard to provide cancer patients with the best surgical solutions using cutting-edge technologies, namely laparoscopic and robotic surgery.
So today, in this presentation, my task is to debunk some of the common myths. There are many myths in cancer diagnosis, treatment, and how the entire journey of the cancer patient takes place. It's not one or two, because every time when we sit in the OPD, when we talk to our patients, they all come with unique questions. Every time there are some times when we get very unique questions which I wouldn't have thought of last time. So what I have done is, I have compiled a few common myths which I come across, and I want to clarify those things in this particular. There are about 10 or 15 of them. So I'll be clarifying as I go on. So, so that is the purpose of this entire talk. So what is the what happens when you really have some thought or something which is there? See, usually what has happened over the history is some ideas people develop and it becomes very popular over time. Like there was a time when everybody thought and the entire science thought that egg yolk is very bad for health. Everybody thought, but then suddenly over time the things changed, right? Today we believe egg yolk is okay to have. The scientific evidence is not very strong to avoid egg yolk. So like that only things have changed over the years, and more evidence has accumulated to tell us that no, what we thought previously was wrong, we need to rethink about it. So what we are going to do today is we'll go through this, the scientific evidence for some of the things which common man can understand, and we will debunk those. The purpose is this, see, when there are wrong ideas, you people get into needless worries and end up making wrong decisions. So the whole idea is that we have to avoid these wrong decisions at the end of the day. So accurate information will make you empowered. You will be able to take the right decision at the right time. Now, first very common myth which is there is cancer is a death sentence. People think, oh, the moment I have cancer, that means it's the end. There is nothing which can be done. But the fact of the matter is, things have significantly changed over the years. There are many therapies which are coming. If you had talked about a situation in the 1990s and all, it was a problem because the treatments which were available at that time was very less. It was very less, and people would surely get into trouble because of getting cancer. So the survival rates were so bad at those days, and we used to talk about cancer as a rare disease. The things have changed. Today, cancer is one of the most common diseases. It's in the top three everywhere. So the things have changed and the treatment has changed. And if you look at the survival rates, especially for early cancers, it is phenomenal. Today we can boast about 90% cure rate in most of the cancers if the patient comes in time. So individual outcome depends on many factors that we have to remember. There is a patient factor, there's a disease factor, and there's treatment factor. So disease patient factor means patient's fitness, how patient well the patient understands the treatment and goes through it in a systematic way. Because if a patient doesn't understand, many times patient is uncooperative and does not go through the treatment. So going through a treatment is very, very important for the patient. So patient factor is important. Fitness of the patient is important. Disease factor is very important because some of the cancers behave very, very aggressively. So those aggressive cancers don't do well. So again, that factor comes in. And a wrong kind of a treatment is constituted is also a problem. If you give wrong treatment, the outcomes will be wrong. So there are times, I have seen many patients, suddenly some doctor will, the moment they see the patient, they'll say, tomorrow I have to operate, tomorrow I'll do the surgery. Wrong. In cancer, cancer is not an emergency. Cancer is a disease where you have enough time to make a proper planning because there are multiple treatments involved. There are a lot of planning that is involved and it has to be done in a very systematic way. You have to put most items, we put the full planning before we start treatment. So the treatment factors, whether the treatment was given correctly or not, also matters a lot. So that is one. Second very important thing, which or I wouldn't number second, third, and all that. I'll just go on talking about it. But other very important thing which people think about is eating sugar will make your cancer worse. I'll answer two things here. One, cancer cells do consume sugar. They are known to consume sugar more than normal cells. It is very true. But in short term, when the person, there is a patient who has cancer, if they consume sugar, there is no evidence that tells us that it will make it worse or grow progressively and make it worse. No, because I get a lot of patients who come to me, they tell me, patients, sons and daughters, very often they'll say, no, I have stopped all sugars for my father or mother. That is a very common thing. But the fact is that evidence, there is no evidence to tell you that sugar will make it worse. In fact, it cannot also scientifically also, if in the short run, when if you talk about like during the treatment or after treatment, it's not how it works. The how it works is a long term consumption. It is about all about the duration. If you are consuming huge quantity of sugar over the years, then it can lead to excess weight gain, that is obesity, and that can lead to cancer. So that is how the progression, the available evidence is like that. Other evidence which is there is insulin. Insulin is a growth hormone. So if a diabetic patient and a person who consumes a lot of sugar produces lot of insulin. I'm sorry, some issues. Yeah. So a lot of sugar, a lot of insulin. So that itself stimulates the growth of cells, and that can cause cancer. So that is the theory. So should a person who's diagnosed with cancer suddenly stop all sugar consumption? The answer is no. It does not change anything. Okay. So when I say that, it doesn't mean that you gorge on sugar and consume huge quantities of sugar. Everything has to be in moderation. Even in Indian terms, amrita, what we call the elixir, that is also poisonous if you have too much. So there is nothing that is not poisonous. So yeah, poison is in the dose. It is not about which is poison. It's all about dose. If you have too much of anything, it is poisonous. Now, uh, other very common thing which comes up, which I come across, is a notion that cancer is contagious. Patients come and ask me, can or the sons and daughters can I have a small child in the house, so will that child be at a risk? Will it spread to my child or to anybody else? Can we eat in the same plate? Sometimes they ask that question. See, cancer is not a contagious disease. It does not spread from person to person. It is not possible at all. So, what happens if at all in cancer is, you know, there are some cancers which are caused by infection itself. Like, for example, there is a viral infection like the human papilloma virus, which causes cervical cancer. There is hepatitis viruses which can cause liver cancer. HIV can cause some cancers, and there are some bacteria which can cause cancer, stomach cancer. So these cancers are not like, you get infection today, tomorrow you'll get cancer. These cancers happen because of the infection which lasts for 10 years, 15 years. It takes a long duration of time. So this is not a spread of cancer from person to person. It is a spread of the infection. This were, 99, 90, more than 90% of the people who get this infection do not get cancer. It will be eliminated by the body. So cancer per se does not spread from person to person. Now, other side of it, I'll tell you. Who said danger? Usually, when we give any treatment for cancer, chemotherapy, or anything, the immunity of the individual drops. Actually, the patient, cancer patient, is at risk from rest of the family because they can carry an infection to the patient. So that is something which you should be cautious about. And other important point which I made over here is a possible uh, one possibility which we always keep in mind is a patient who, or a cancer patient, cannot give an organ for donation. So if somebody had cancer even 10 years, 15 years before, if they think, okay, I'll donate my kidney to somebody else, that kidney cannot be accepted. The reason is the tissue transplantation. There is a small risk, 2 cases per 10,000 patients transplanted. If they have cancer, there is a risk of that cancer regenerating in the transplanted tissue. So that risk exists, and for that reason, that is not done. Generally, it is not accepted as a donor. Now, other important, very often, which come, many people tell, my father or my mother, or I have a very very positive attitude, and attitude will make the person win. Attitude makes things better. I know our uh, you know psycho-oncology talk will tell you about it. Dr. Jaitri will be talking about it. But attitude matters. Attitude matters because you need to go through the treatment. But will it make a difference in the scientific outcome? The answer is no. But is it important? Yes, because you need a winner attitude to go through what you have. You need to understand that, okay, I'm going to do it. You Because it is not impossible. You to win in anything, a positive thinking is very important. But scientifically, does it make, if you're dull when you're taking chemotherapy, does it make a scientifically, does it make a difference? No, the answer is no. Now, coming to the next question, cancer surgery causes cancer to spread. Very, very common problem. Patient comes to us and says, I have heard that surgery will spread cancer. In fact, it's one of the most foolish notions that many people, and possibly it has come out of very bad surgical techniques of some of the surgeons. Probably that has caused, because it's like, I always say, it is like, when see, if there is a waste in your house, you have to carry it and throw it out of the house. But if you make a hole in the waste bag and carry it, it is going to spill everywhere, so it's going to spread. So basically the idea is that, it should there is a meticulous technique which is involved in cancer surgery. And if that is followed, the whole intention of treatment of cancer surgery is to remove the tumor, so it works beautifully. That surgery constitutes for 80 to 90% of cure rate, in, especially in early cancers. In fact, that is the only thing which is required in many cancers. So metastasis, what we call, cancer spread is actually called metastasis. Okay, that's a terminology, medical term for spread. It happens because of breakaway cells of the tumor, and it's a complex biological process, and it's not generally caused by surgery. But technique of surgery is very important. That is followed always by all the most of the surgeons who are trained in that. At least the cancer surgeons will follow that. And there is proof to this also. Clinical studies have proven, because when such kind of a question comes, there are studies which have proven that it does not affect the cancer does not spread off because of surgery. Multidisciplinary approach treatment is the key for cancer treatment today. One treatment does not help. The very reason why we have been successful in cancer treatment is because we are able to give multidisciplinary treatment. Okay, so there is evidence, there is enough evidence. In fact, there are large clinical trials which was done because of this myth itself that has been done. There are studies which are including 34,000 patients, more than 1 lakh patients. All of them have categorically told that there is no evidence that surgery will cause a spread of cancer. Now, another very common question is, if I get a biopsy done, suddenly it will spread. The fact is, again, I'm just giving you the evidence that there is enough evidence. There are these are cases, these are published studies where they have studied more than 6,000 patients, more than 2,000 patients, and they have conclusively proven that in most of the cancers, biopsy does not spread the disease. And biopsy is essential to make a plan, because without biopsy we cannot say that this is how the planning is, this is what we are supposed to do. The biopsy is required to make a proper planning for cancer treatment, so it's very important. And another important point when I say this, there are certain organs where we do not do biopsy. I have given it below here: ovarian cancer, gallbladder cancer. If we see that it is an early cancer where we can do direct surgery, we do not prefer to do biopsy, because gallbladder and ovary and all are like cysts. They're like fluid filled cavities. You put a needle, it can burst. Stage 1 can become stage 4. So the decision process depends on what is the stage. Early cancers in gallbladder and ovary, we don't do any biopsy. So don't generalize things. Another very important thing, because if we tell something for one thing, generally people think, okay, everywhere else it will apply. It does not apply. It applies to only that area. Another very common thing: cell phones cause cancer. People are making a lot of noise about this. Again, I went around getting the evidence for this. There are very large studies which have been done on this, especially for brain cancer. They thought that there is evidence it causes. But the fact of the matter is, after all this, more than 7-8 lakhs, 3.5 lakhs people they followed up, they took studied it, and they published finally that there is no evidence of uh, that it causes any brain tumor. It was for brain tumor. Interesting story here. What happened was, initially when newspapers gave a good publication, publish this thing very aggressively, telling that cell phone use can cause cancer. But how they did this study was, uh, they asked people who had brain cancer, did they use the cell phone more on that particular side. Okay, and all of them said, yes, I used on that side more. But what it turned out was, you know that was a false representation, because we are looking at the memory of the patient. You are asking them what they did, and always there is a recall bias. People will have a bias to say that, okay, I have, because I because the person is asking, they'll say, no, it is there on that side. So eventually what they realized was, use of cell phone decreases the incidence of brain cancer on the opposite side, which means it's contralateral. So it decreases on that side. It's below the normal population level for surprising reason. Means, it was a actually not a real result. It was biased because of the memory recall. So the fact today is there is no evidence to prove that it causes. And I'll tell you another bit of science. The radiation emitted by cell phone is not ionizing radiation. So ionizing radiation is known to cause cancer. Non-ionizing radiation is not cancer carcinogenic. It does not. Okay. Now, herbal products can cure cancer. That's another thing, very common problem. People, there are quacks, lot of quacks who say, I'll cure cancer and all that. But the problem or the thing is, they don't have liability. Nobody's going to sue them in the court, or nobody's going to take them to task. So the fact is, there is no reliable evidence to tell that it will cure. And the fact is, potentially, there are many herbal products which can be very harmful to you on direct consumption. And especially if you take it along with chemotherapy or radiotherapy, it can be more harmful. In fact, we are very scared of herbal products because they have multiple things in them. It's not purified. So they have other contaminants. There are so many other things. It's an uncontrolled product. There's no quality check. So many things can go wrong when you consume a herbal product. So it is very herbal products in the sense I'm talking about not already branded good quality stuff. I'm talking about those things which you purchase from a quack on the some forest or something like that. They are quite dangerous. So be very cautious. Don't go for it. They have a lot of side effects which are not known. That is a problem. It's not documented, so you don't know. So you'll once you end up in trouble, only you'll come to know. Other important thing very commonly we come across is, if somebody in the family has cancer, I'll get it. The fact is, no, it's not that simple. The incidence of what we call as hereditary cancer is only about 5 to 10%. So it is not that everybody, if one person has cancer, you have a high risk. There is very particular way in which we assess that. A genetic counselor will tell you that, this is the way we go about. So there are certain criteria which we use. I don't want to go into it, but the answer is the possibility of anybody getting cancer because of inherited genetic defect is only 5 to 10%. It is not more than that. Okay, so that is very important to remember. So again, another very common thing, antiperspirants, will they cause tight bra? Does it cause breast cancer? Very common question which we come across. In fact, scientifically, it is not possible that tight bra will cause any cancer. But when it comes to these deodorants and antiperspirants, there was a compound called parabens which were known to be associated with they look like estrogen compound, which is a female hormone, which is known to cause breast cancer, but that also is not very strong evidence. If you there is a relationship, the structure of the molecule is similar, so it might cause, is one of the theories which is there. So and the fact is, most of the deodorants today do not have parabens, so that way also you're protected. Chemotherapy is painful. Mm, the answer is yes and no. Very often people come and ask, doctor, chemotherapy is painful. I'm worried. In fact, the most common thing, painful factor of chemotherapy is the pricking itself, and that we can avoid by using what is called as a chemo port. We don't have to, uh, keep on pricking the patient for giving chemotherapy. There's a device called chemo port, which is put, which makes chemotherapy most painless and comfortable. Now, coming to the other factors, yes, there are some factors which could be painful, like the oral ulcers, which are mucositis and all that. There is some, because we give injection for neutropenia, means counts going down, that can cause some amount of pain and all that. But the most common cause of pain, which is multiple pricks, which the person has to go through, that can be completely eliminated by using chemoport. So by far, I have covered a few myths which I thought were important for a person who's going through uh, cancer therapy, and the family also needs to understand it. And those I have covered in a very brief fashion, as good as I could. But there are much more to talk about, but I don't think this is the forum for that. Thank you very much.
Thank you so much, sir, for this amazing presentation. I'm sure that our patients and caregivers are benefited by this presentation.
If there are any questions, I can take it now also.
Um,
I,
patients and caregivers are kindly requested to share their question we have with us, Dr. Nayak himself.
Somebody has asked, can sugar-free, okay, sugar-free products. See, recently WHO has designated some of the sugar-free molecules as a positive factors for cancer. They have, but see, the evidence is not very strong. Uh, and also other factor you have to remember that there is evidence that sugar free does you may think that it will reduce your calorie intake, but the evidence today says that it does not, because what it does is it cheats your brain into thinking that you are consuming sugar, but in turn your desire to have sugar, because it's not giving you calories, so your desire to have more calories to compensate it may happen. So there are many dietitians today are recommending that avoid it, control your diet, don't consume too much sugars. And there are many sugars which are just literally hollow calories. You can actually not you can survive by not taking them. So you can avoid it and you can be comfortable. So the answer is moderation. Even if you're taking sugar free, don't gorge on it. It's not going to change. It can be worse than having sugar for you. And try to live on less amount of sugar. I'm talking about raw sugar, the refined sugars, which includes jaggery. And where there is a people think jaggery is safe, honey is safe. Actually all are sugars. None of them are safe, whether it's natural product, unnatural product, chemical, human manufactured things. None of those things are safe as well if you don't consume those things in moderation.
Thank you, sir. We have another question from your patient, Mr. Raghavendra Bhuramurthy. He has
Okay.
asked us, my lobectomy was done by a team headed by Dr. Sandeep Nayak in August 2021.
Okay. Okay.
So I am on adjuvant oral chemotherapy with one tab Tagrisso osimertinib 80 mg per day since 7th October 2021. I am asked to take it for 3 years. At 6 monthly intervals, I am asked to have a PET scan done. As the PET scan involves nuclear medication, will it not have any side effect? And her second question is, if the next PET scan sometime in February, March 2024 is negative, can I stop Tagrisso? If yes, should it be done in phased manner, that is by tapering the dose and the interval between two doses?
Very good. It's a purely clinical question. Okay, so I'll just put it in simple things. See, the dose which is given for PET CT, you know, is nuclear medicine dose is not going to harm you in any way. It is very less. It doesn't. It's not like a huge load of radiation. It doesn't harm to that extent. Uh, and it's eliminated almost within 3 hours. Your body eliminates it quite well. The radiation dose of CT scan is also is significant, but that also, see, if it is required to do it, you have to do it, because the entire life is about balancing, right? There is a trade-off always. So it is not like you have to, uh, if it is necessary, you have to do it. Generally, we follow an yearly PET CT for most of the patients, but this situation because of osimertinib or something like that, I think we would have changed some protocols in your case. And now, your drug duration is decided based on the protocols. It doesn't, dosages are not generally reduced in midway through the treatment and all, unless you are not able to tolerate it. That is a policy which is followed. So it is not like it is not decreased in steps. It is stopped at a time when it is appropriate. That is how it is done.
Thank you, sir. Again, we have received one question. How well is the MRD well documented in India as a prognostic factor?
What is documented?
Uh, how well is the MRD well documented in India as a prognostic factor?
He's asking, he or she is asking about medical records. I think they're asking about medical records for. Is that the question? That is the question, yes. The documentation process in India is very bad. It's very bad. In fact, very few centers and a few people really give lot of focus to the documents and maintain the documents quite meticulously. uh, because I struggle and maintain it myself, and I invest quite a bit because I want to give quality at the end of the day. But it takes a lot of effort, and this one, there are technology and software available to do it. It's all software based, so everything that we do is using software, so we can generate data. Because very often I am involved in a lot of research, so we do maintain certain amount of high quality data. But by far, yeah, it is not as good.
Sir, I guess the patient is asking minimal residual disease.
Oh, because MRD can mean medical records also.
Yes.
So minimal residual. So what is the question? Minimal residual disease?
So minimal residual disease. The question is, one second, sir. He has asked how well is the MR well documented in India as a prognostic factor?
See, MRD is used for lung cancer and many other lung cancer. It is being used quite extensively. Uh, so, in fact, it can easily be used for many other cancers where there is circulating tumor DNA in the cell, in the blood. So, in fact, we can easily do a test in the beginning of the treatment and middle of the treatment to see the response, and end of the treatment to see the residual. So that is done. It can be utilized and it is available in India. And it can be done, but I think very often we are not using it in many patients. Some indications are a few, and people who can understand it, we can offer. That's how it is. So it's not like many other things which are today the standard of care. So it is just upcoming. At research level, there are many studies are using it, especially lung cancer studies.
Thank you, sir.
Something other question was there. What was it?
Yes,
Or
sir.
should I think, yeah.
So one
She has
question.
answered it. Yeah. Okay. Yeah.
Okay, sir.
Right. I think we'll get late also. Other things are there. You have to complete your presentation also. What should be the diet of an ileostomy patient with high stoma output? Okay. Diet, see, high fiber diet would really make a difference. I think, Sharmila also can answer that question, right? She's on this thing. So, high fiber diet will make a difference, but ileostomy output comes down over time. It becomes harder as it goes on. But yeah, let her take that. That's the main thing. Otherwise, we have to give medicines to reduce the motility of the gut. That also works, right? Okay. Go on with. I think we should go on with the rest of the presentations. Thank you. Thank you very much.
Thank you, sir, for this amazing presentation. I'm sure that this amazing presentation is extremely beneficial to all our patients and their caregivers.